I do want to today raise with you the issue of healthcare spending, because last Tuesday your government presented a once upon a time in a land far, far away sort of budget, a budget that was really full of gaps and with dodgy estimates exposed in many ways as a work of fiction. And nowhere was this clearer than in the health spend. Your government announced a health budget with a €2 billion hole in it. And Bernard Gloucester, CEO of the HSE, has himself said that the monies allocated to the health service in the budget are inadequate, that the funding is not sufficient to meet the expected demand for health services. This is very serious. We're seeing the front page of the Irish Independent today, however, revealing that government TDs are apparently less worried about the substance of Mr Gloucester's concerns than they are about the very fact that he stated them at all. And yet, these concerns are very real. Tánaiste, it's extremely serious that the Minister for Health has announced a recruitment freeze during a staffing crisis, an acknowledged staffing crisis. This is a hammer blow to all those who work in the HSE who are telling us how under-resourced they are. And it's a hammer blow to Bernard Gloucester, who clearly he says that patients will be harmed without the recruitment of additional staff. But most of all, it's a hammer blow to the people of Ireland, to those who are now wondering, will they have access to health services if and when they need them? So the freeze on recruitment is frankly outrageous, because having begged doctors, nurses and healthcare workers not to leave us for Australia and other places, you've effectively now turned around and said, never mind that actually. Just this week, HIQA has reported that staffing in hospitals such as St James's and the Mercy is at a critically low level. The INMO are warning us that the recruitment freeze will send the healthcare system into freefall. And adding insult to injury were the comments of the Taoiseach in the Dáil on Tuesday when he played down what he termed just the talk of a recruitment and retention crisis, one that we're all hearing about all the time in our constituencies. So, Tánaiste, your government's refusal to return to the rest of us here on earth is evident throughout the budget on health. More than 4,000 patients may be unable to access potentially life-saving treatments next year due to the decision not to provide dedicated funding for new drugs. We know that more than 6,000 people across the country are desperate for access to home care due to a lack of carers available, and almost 900,000 people languish on some form of health waiting list, over 100,000 of whom are children and young people. We're hearing today from the Public Accounts Committee, under questioning from Deputy Alan Kelly, that the new Children's Hospital is drifting further and further out of reach, with a projected spend now of €2 billion. And the blame lies squarely at the feet of government. Tánaiste, most galling of all is we don't know who is responsible for this shortfall in funding. Is it the Minister for Health, or is it the Minister for Public Expenditure and Reform? So, Tánaiste, what we want to know is, can you explain to people whether you can ensure safe staffing levels through the winter, and what plan is there for the health service to ensure that sick people who present at hospital will not be left on trolleys or sitting on chairs?
Tánaiste. It's the entire government produces the budget and deliver the budget across the board. And I just want to say at the outset that in terms of any reports or whatever, I fully respect the right of the Chief Executive Officer of the HSE to comment on the budget, to brief TDs. He wouldn't be the first CEO to brief parliamentary representatives in the House, and also to engage with government in respect of issues pertaining to the budget. So I have no issue with the new CEO engaging with public representatives, or indeed with making, doing interviews and so on like that. And he's a very experienced public servant. He's been 34 years across the public service. He was very involved with TUSLA and in reform of TUSLA, so we look forward to working with him. He's only 6 months in the job. And I also would say to the Deputy that the Irish healthcare system has received very significant investment over the last number of years since this government came into office. The health sector has been prioritised with increasing budget allocations of over 7.4 billion, additional 7.4 billion since 2019, and that's excluding funding for disability services. So that by any yardstick, that is a very significant increase in funding over a relatively short space of time. And in that context, my view is that we do need to do a deeper analysis of healthcare expenditure in itself, paralleled with an analysis of future trends in terms of ageing, demographics, a more specific study. Because I've noticed in some of the opposition budgets leading into the budget, the amount that they allocated was very similar to what the government has allocated. But Sinn Féin, no, Sinn Féin, you're very, yeah, your budget is very same. You're about 1 billion. No, that's right. No. You're getting very nervous now responding. It's the Labour Party's opportunity now, and I'm just making that point. But that needs to happen in my view, because cost management, and I'll come to the recruitment issue, is very important. And when I was Taoiseach in 2020, we were presented 2019 was meant to be $1 billion in the structural deficit. We dealt with it. We dealt with that, and we added more. Okay, and lo and behold, there's going to be a very substantial deficit again this year. So it needs examination, given the scale, and it applies to all parties in the House, given the scale of increase that's occurring on an annual basis, and some of that is societal demands, ageing, demographics, inflation, and so forth. And by the way, you know, we know that expenditure has worked as well overall, I would say, over the last decade or 2 decades, 3 decades, because our survival rates for cancer, stroke, and infant mortality have really hugely improved, and so on. And this year's budget will facilitate significant developments. But I just want to make the point on the recruitment.
Time is up.
Lots of posts that have been funded haven't been recruited. So it's not a lot of the recruitment we've experienced in last year is not funding related. It's human resource related in terms of recruitment of person.
Tánaiste, your replies just don't pass muster, if I may say. You speak of a need for an analysis, for examination, but the reality is you're in government and your party has the Ministry of Health. So we need to hear from you. What are the plans? What are the figures that are going to work in the budget? Because clearly your figures in last week's budget simply do not add up, and that's acknowledged. So where are the plans to help struggling people working in the health service who are so under-resourced and overstretched? Where are the plans to help patients? Like the woman who contacted me who developed blood poisoning, was left on a chair overnight, propped up against a wall due to a lack of beds. All of us are hearing from people who are telling us they were turned away from scheduled appointments because of lack of staff, having booked time off work, having fasted for their procedures. Now that sort of thing does not happen in a properly resourced health service. And you're in government. It's simply not good enough to hear from you comments like you were a commentator, saying that there's a need for analysis and for examination. Do something about it. Ensure the health service is properly resourced. Ensure that the appropriate minister, the Minister for Health, is in charge of the budget. What we're hearing makes it unclear to us whether it's Minister Donnelly or Minister Donoghue who is calling the shots. But either way, there is not enough money for healthcare, and it's patients and staff who are going to suffer.
Your colleague Brendan Howlin, who was both the Minister for Public Expenditure and the Minister for Health, he might fill you in and give you some insights into how the process works. But what I could say to you is that we have cut costs for patients. We have cut costs across the board for patients. We've removed inpatient hospital charges. We've had the biggest expansion of access to free GP care in the history of the state. Up to 60% of our population are now hold a GP or a medical card. We've reduced the drug payment scheme costs. We've funded diagnostic scans for patients. We've introduced free contraception to women up to the age of 31. We've publicly funded assisted human reproduction, including IVF, for the first time ever. We've agreed a new consultant contract. Up to 700 have signed up. We've added more than 22,000 staff since 2020. 22,000 staff have been funded since then. We've increased our hospital bed capacity by over 1,000 beds at the same time. We've also expanded our ICU capacity. We're growing college and training places today. For every GP who retires, between 1.5 and 3 new GPs are working. And we've expended huge funding in terms of the pandemic. So, we're doing the action, Deputy.
Thank you,
but having said all of that, and with $7.5 billion additional since 2020, yes, it is. I'm making the point. There's nothing wrong in saying that you need further analysis of this in terms of a growing population. That's logic and informed, and not just sort of...
Deputy Mick Barry, please. Could we have a little less heckling, please?